Hi friends, welcome. I'm Buddy Wagner, your mental health professor. Do you suffer from allergies? If so, you've come to the right place. Today I want to share with you a technique created by Tim Halbum and Susie Smith to cure allergies. And so to begin with, I want us to calibrate your allergic reaction. So I want you to take a moment and just imagine yourself coming in contact with that substance of which you're allergic. And just begin to feel the symptoms just a little bit. I don't want you to have a full-blown reaction, but just begin to feel the symptoms a little bit. Maybe it's runny eyes, maybe it's sneezing, maybe it's whelps on your skin, but just a little discomfort. And once you begin to feel that discomfort, then you can stop and shake that off and return to normal. And now I want to explain to you what creates an allergy in very simple terms. You have different kind of cells that run through your body, and these cells do various functions. You have some seeker cells who go through your body looking for anything that it deems dangerous to you. And when it finds something that it thinks is dangerous, it puts up, metaphorically, a little red flag. Killer cells come along behind the seeker cells and attack wherever there's a red flag. And then sweeper cells come along behind the killer cells and sweep out the debris. And so the substance you're allergic to, and let's just suppose that it's dust. So let's use dust as an example. So when you come in contact with dust, your seeker cells thinks for some reason that dust is dangerous to you. And so it puts up a flag. Killer cells attack your body where the flag is, and that's what causes your symptoms. So what we want to do is educate your immune system so that it understands that dust is not dangerous and it doesn't attack your body when it comes in contact with dust. And so I want you to imagine a 2-inch thick piece of plexiglass. It runs from the ceiling to the floor and from one wall to the other wall in front of you. You can see through the plexiglass, but nothing on the other side of the plexiglass can get through to you. And I want you to imagine as you look through that piece of plexiglass that you see a you on the other side of the plexiglass. But that you's immune system is educated. It knows that dust isn't dangerous. And so when that person comes in contact with dust, nothing happens. There's no allergic reaction because its immune system is educated. And so let's think of something similar to dust that you're not allergic to. Let's say white flour. You're not allergic to white flour. And so I want you to look through that plexiglass, see the person on the other side of the plexiglass, and see that person come in contact with white flour. And as you see that, touch your thumb and your middle finger together to set an anchor. And of course, nothing happens when that person comes in contact with flour because he's not allergic to flour. And then I want you to see that person come in contact with dust. And as that person comes in contact with dust, again, touch your thumb and your middle finger together to set that anchor stronger. And of course, nothing happens because that person's immune system is educated and it knows that dust isn't dangerous. And then I want you to imagine that you come in contact with flour. And as you do, you touch your middle finger and your thumb. And of course, nothing happens because you're not allergic to flour. And then I want you to imagine that you come in contact with dust. And as you do, touch that thumb and that middle finger together, and nothing happens because now your system knows that dust isn't dangerous. And then again, imagine you coming in contact with dust and realizing that nothing happens because your system knows that dust isn't dangerous. And so through that simple little exercise, you've cured yourself of the allergy of dust. Now, should you have the allergic reaction when you do that, then you want to go through the exercise again and again until you eventually communicate to your immune system and convince it that dust isn't dangerous. Now, if you have an allergy that is deathly, of course, you want to use common sense. Don't be reckless with this. Make sure that you have the antidote present should you have an allergic reaction. Be smart so that you do not cause harm to yourself. I hope this has been helpful. If so, please hit the like button and the subscribe button. And if you know someone who could use this information, please pass it on to them. I'm Buddy Wagner, your mental health professor, wishing you the best of mental health.